Hi, in this video I'm going to be talking about how to find the best medical team if you're going through breast cancer and its treatment. And this actually applies to people regardless of the type of cancer that they have. So what is your medical team? When we talk about a team, what are we talking about? Well, a team includes not just doctors, but your nurses, nurse practitioners, physician assistants, phlebotomists, the assistant at the desk, right? All of these people contribute to your experience. And because we know that burnout rates are really high now in the healthcare system, we have to ask for grace as healthcare providers, but this is really important for you. You might know that, yes, they're taking care of several hundred patients, but you are the only person right now that I'm going to talk to. So your medical team in breast cancer care, you're going to likely see a surgeon, a radiation oncologist, a medical oncologist, social workers. You might see a financial navigator. You might have a navigator for your entire course. You're going to see a radiologist who does mammography. You might see an ultrasonographer. A radiologist reads all of the scans you have done, so they're behind the scenes. You might see a nutritionist, a physical therapist, a plastic surgeon. Oh, it's so many people. How do you keep track? Well, try to find somebody in your family who can help you keep organized, or if you yourself find that being organized is really helpful for you, I've seen all kinds of things. I've seen people have notes on their phone, a binder that can help collect things that people give you and questions you can ask the doctor. You might want to have a place to house all the information you know about your cancer. And if you are interested in learning more about this, I would recommend you go to Yerbba.com to learn more about what you might expect during your breast cancer journey. Also a term I know not everybody likes, but during this whole process. So lots of different people, and it seems like sometimes you have no control over who you're going to see. So sometimes you'll get a call from the mammographer who did your mammography and says, I want you to see this surgeon, or your primary care doctor may help orchestrate who you're going to see first. Your gynecologist might be involved. Another type of doctor may be the one that you see first. It might be your neighbor, and they might recommend where to start. The key thing with breast cancer is it really is a whole team. And the thing that my patients find, and that I know from the literature, people find most helpful is to know that your team is going to be talking not just to you, but to each other. Now, we can do that in multiple different ways. We can do that through the medical record with our notes. Those we use as a form of communication, not just with you, accessing your own records, but with each other. And now we can actually get records through multiple healthcare systems. So through things like Care Everywhere, you can get the records even if one doctor uses a different medical record from another doctor. So we're really making some advances. But I have to tell you, the best technology these days is the telephone. And a lot of us call each other on our cell phones. I remember the name of the surgeon I worked with the most when I was at the University of Rochester. I still have his phone number memorized. And I think it's really nice to know that before you see your team, your doctors have talked about you with each other so that you don't get a really choppy plan. Now, if you're on the other end and the plan feels really disjointed, what do you do? Well, the key is to make sure you have one sort of anchor person, like in a relay race. There's an anchor, somebody that can be your touch point. Now, that may change. After surgery, you don't see the surgeon as much. It might become the medical oncologist, the person who's helping decide with you whether chemotherapy is part of your treatment plan, or if you're not going to have chemotherapy, the radiation doctor. I would never hesitate to ask your primary care doctor to be the main point of contact. If you have a good relationship with your primary care doctor, they can certainly be sort of the clearinghouse or the orchestra conductor for all of this information that's passing. And if you're finding that it's not clear that your care is coordinated, reach out to your primary. They can be your advocate. A lot of people don't have a primary care doctor, or their primary care doctor is retiring, or on sabbatical, or out of town, or they're dealing with an illness or a family member's illness. So it's not always clear that it's going to be a primary care doctor. Maybe the nurse practitioner in your PCP's office can help. PCP is primary care provider, can help be that person. But making sure your care is coordinated is going to give you that sense of comfort and sort of being in charge, that somebody is partnering with you. Let's say you're starting from scratch, or you've seen a doctor who you didn't quite gel with. Couple things. It's really important that you give people a bit of a chance. We all have our off days, right? You have your off days. When you're at work or in the family, you might snap at somebody, and it's not a reflection of who you are. My daughter always says we shouldn't judge people based on their worst days, on the worst thing that they've done. So if this doctor came highly recommended, or you like the rest of their staff, I would encourage you to give them another chance. If it's very clear this is not going to be the person, you can ask your primary care doctor, or let's say you didn't really like the surgeon, but you love the medical oncologist, or you didn't really love the medical oncologist, but you love the surgeon. Just let them know that. Even if they're good friends, it doesn't matter. This is about you and your care. And there might be something that very favorite best friend did that reminded you of somebody you didn't really like, or reminded you of your mother or your ex-husband. So it's okay to switch. That's all right. It's not urgent that you get right into care. Breast cancer treatment is usually not an emergency. And you really want to be comfortable, because you're not just going to be with them during treatment, you're going to be with them in follow-up. And if things come up, you really want to trust them. Okay, so I've covered a lot. I've covered who's on your team, how to find the team, and I have some other tips, what to do if the fit doesn't feel right, and who's in control of all of this. Sometimes when we're going through this, we don't want to feel we are in control. We want to feel that we're in partnership. So what about word of mouth? What about going online to find a doctor? So a couple things about that. Word of mouth is a great way to find somebody who's good. In fact, many of the patients I've seen found me because somebody in their community had an oncologist I took care of. And similarly, when my patients move out of town and need to find an oncologist, I will say, yes, you might go on the medical center, academic medical center website and find somebody who's really famous, but when you meet with them, it doesn't click, ask your neighbor. And actually that turns out to be a really good way to find somebody. It's not always the case that the professor, the chair of the department is the best person for you. They may be very caught up in research. They may already have a full load of patients. You want to find somebody who has enough time for you so you don't feel rushed. What about a new doctor, somebody who just finished training? You actually are super duper smart when you just finished training, because you just had to study for your boards. You also have all the people who trained you that you are very comfortable going to and asking for, to discuss somebody's case. So if, let's say you have an unusual cancer and you're seeing a doctor who's not been in practice a lot, I can guarantee you they know who to reach out to. They know what they don't know. And so don't hesitate to see a younger doctor. What's the advantage of a younger doctor? Well, besides the fact that they know everything that's new and had to study for that test, and that they have a network of people who help train them, the other thing is that they have time to spend with you, they know what they don't know, and they're going to be in practice a long time. So this will be your partner in care for many, many years. So lots of advantages. So what happens if you don't like your medical team, one of the members or the staff, it just doesn't feel right, and your family may think, they're wonderful, what's wrong? And your primary care doctor may say, I've picked this plum team for you, what do you do? Well, it can happen, right? And I have had many patients say, I don't want to change doctors because I don't want to hurt their feelings. And I just love that empathy, that, we do care if we've upset you or it's not a good fit. So I love that people think about that, but this is your one life, and you need to be the most comfortable person. So what do you do? Well, finding who you want to go to is a good step, and I've covered that already. I also recommend that you consider strongly talking with the doctor or the team about why you're leaving. So let's take sort of the lowest risk case where it's somebody on the staff, a receptionist or a valet, or it's the parking. Tell them that. Tell your team why you're leaving, because they need to know, right? It can be hard to talk about. You might love the doctor. You don't want to tell them something bad about the staff or get the staff in trouble. but they really need to know. They serve you and your family. What if it's the doctor themselves? This can be really hard. Firing a doctor, which is what we call it when somebody fires us, is really hard. But it's, to us, easier to know what went wrong and can we make it right even if you leave? Can we apologize for how things went? It makes us better. And you want to go to a doctor with a growth mindset. You want to go to a doctor who wants to get better and better. Now, they might get defensive, so you might think about writing a letter. Writing one with compassion. Don't write it to their boss, write it to them. So I know this sounds hard, and I know it takes energy. You don't have to do it right away. You can do it down the road. You can have somebody else in the family do it. But I would strongly consider it. Again, it's not your job, but it's something to consider, a way of paying it forward, making us better. I've covered a lot. How to find a team, who's on your team. You might want to check out yerbba.com to see what kind of doctors you might be seeing. We've talked about how to change teams. We've talked about you like one doctor and you don't like the other. I hope this has been useful to you. If it has, click like and subscribe, and that will help people find this channel who are going through the same kinds of things, people with the same kinds of questions you have.